first part of your assignment is doing a needs assessment. And essentially, whenever you work with the community, whenever you want to do a community project, you always need to start with the needs assessment. So when we're looking at the definition of a needs assessment or of an assessment, it's basically looking at stats, looking at data to see what the community's health needs are, or what the community dental health needs are, to be more specific. We want to see whether the community is lacking in education for brushing and flossing, if perhaps they're a non-fluoridated community and they have a high caries risk. That's something that we can address. So we're looking at the status of their dental health. Now, eventually, when you graduate, you have the option of working for public health. And what public health does is their mission, is to prevent disease. They want to prevent any type of disease, including dental health diseases, such as caries, gingivitis, periodontitis. And their goal, the mission of public health's goal, is so that everyone can live and function healthy. There are many determinants of health that come into play, and there is a different video on the determinants of health that I'm going to encourage you to watch so that you have a better idea of what affects the community's health. So for dental public health, what your role is, you want to prevent and control the dental diseases. And to do so, you could offer education by teaching them how to brush and floss, by teaching them about the nutritional needs, by teaching them about dental care. And in doing so, you would prevent caries. You could prevent gingivitis and periodontitis. Okay, so that's our goal. We're trying to prevent and control any caries, any periodontal disease that could be occurring. So what I'm skipping through over here is in a different video that I'm going to encourage you to watch. It's called the Determinants of Health video. So in the assessments section, that's the first step, of a community assessment. These are some questions you can ask the supervisors. You can research yourself. Depending on the community that you're interested in, what are their strengths? What are their problems? What are their concerns? How can we help them? So what are some potential solutions we can offer to the community? So once you figure out what you're going to ask or what you're going to research, once you plan what you're going to do for the needs assessment, gather the information. It can be going to the Health Canada website and gathering all the data from there. It could be asking the supervisors for information. So you need to gather the information, gather the data. And once you've gathered the information or the data, then figure out what all their needs are and prioritize. Is it more important for them to learn how to brush and floss, or is it more important for them to have a fluoride application because they're high risk for caries? So maybe we could do a fluoride application to all the kids in the school. What is more important? So prioritize the issues. And then once you're done all this, evaluate everything. So go back and look at your list that you have identified with all the needs, and go back and see what is absolutely more needed. And you can evaluate the needs assessment by talking to the supervisor of the place you're going and asking them, you can come forward to them and say, based on my research, these are the needs that I have noticed. Let's prioritize them together, and then let's evaluate them together as well. So when we're in clinic, we always follow ADPI, where we look at the client's assessment by doing extraoral, intraoral, hard tissue, radiographs, and then we come up with a care plan or a treatment plan, and then we'll implement it by educating them, by providing debridement, by providing nutritional and tobacco cessation counseling, and then we'll evaluate them. So they'll come back at 3 months, 3 months, 4 months, 6 months, or they could come back at the 4 to 6 week re-eval, and we would evaluate their dental health. Well, in the community, it's very similar. So when you go to a community, you're still going to assess, right? Assessment is still very important. You're going to assess. And to do so, you would ask the supervisors the necessary questions. You would collect data from Health Canada and other resources, and then you would identify what is most important. And then you would also evaluate the assessment. Once that is done, you would then plan. You will then decide which need is most important, and you would plan on how you could meet that need. Then you would implement. So this is when you're actually doing the virtual presentation. This is when you're actually maybe going to the facility to offer the education or to offer even fluoride services. And then you would evaluate. Now, for evaluation, we'll have a lecture on this, but there are different ways you can evaluate. You could do a survey. You could you could ask the supervisors for their recommendations on how to evaluate. But basically, anything you do, it needs to be evaluated. And again, we will talk about this later on. So to recap, needs assessment is essential. We need to do that. And it's the information that we get from the needs assessment will be very helpful for us to plan what is best for this community and then to implement it. So now we know what we should be discussing when we do the virtual presentation. And then evaluation is also important as well.